Welcome to Interferon gamma release assay testing training video for clinical staff. After watching this video, viewers should be more familiar with 1. Testing age requirements for those requiring IGRA testing. 2. Approved IGRA tests that can be used. 3. Important steps after blood collection. 4. Reacting to an indeterminate result. 5. Turnaround times. Let's begin with the first learning objective: testing age requirements for those requiring IGRA testing. The age group for IGRA testing can be divided into two categories. Applicants 2 years of age and older examined in countries with a World Health Organization estimated tuberculosis incidence rate of 20 or more cases per 100,000 population must have an IGRA. 2. All applicants younger than 2 years of age examined in countries with a WHO estimated tuberculosis disease incidence rate of 20 or more cases per 100,000 population must have a physical examination and history provided by a parent or responsible adult who knows the child best. Applicants who have signs or symptoms suggestive of infectious tuberculosis disease or have known HIV infection must have an IGRA or tuberculin skin test. 3. All applicants younger than 15 years of age examined in low tuberculosis burden countries, defined as countries with a WHO estimated tuberculosis disease incidence rate of less than 20 cases per 100,000 population, must have a physical examination and history provided by a parent or responsible adult who knows the child best. Those applicants who have signs or symptoms suggestive of infectious tuberculosis disease or have known HIV infection must have an IGRA. TST may be used for those younger than 2 years of age. 4. IGRA must be performed for these applicants if a U.S. Food and Drug Administration approved or WHO approved IGRA test is licensed for use in the country in which the panel physician is practicing. If an FDA approved or WHO approved IGRA is not available for use in the country, the panel physician must contact DGMH by emailing panel physicians at cdc.gov for further guidance. 5. TST may only be used in children under 2 years of age when indicated, or when IGRA is not available and use of TST is approved by DGMH. Now that we've covered the age group, let's move on to our next learning objective: approved IGRA tests that can be used. CDC will allow use of IGRA tests approved by the U.S. Food and Drug Administration or the World Health Organization. If the panel physician does not have access to an approved IGRA test, the panel physician must contact DGMH by emailing panel physicians at cdc.gov for further guidance. Panel physicians must follow the manufacturer's written instructions for collecting samples, performing tests, and interpreting test results. IGRA results must be available within 72 hours of sample collection. CDC will allow use of IGRA tests that use enzyme-linked immunosorbent assay and/or generate both qualitative and quantitative results. CDC will not allow the use of lateral flow IGRA tests or IGRA tests that only provide a qualitative result. In this segment, we will focus on the third learning objective: important steps after blood collection. These guidelines will help mitigate indeterminate results. You should shake tubes to minimize indeterminate results. Factors to keep in mind include the following. 1. Deviations from the package insert may yield erroneous results. Please review the package insert instructions carefully before use. 2. For IGRAs other than T-spot TB, A. Immediately after filling the tubes, shake them just firmly enough to make sure that the entire inner surface of the tube is coated with blood. This will dissolve antigens on tube walls. B. Overly vigorous shaking may cause gel disruption and could lead to aberrant results. 3. For all IGRAs, do not under or over incubate the samples. Incubation start and stop times should be documented. In this segment, we will focus on the fourth learning objective: reacting to an indeterminate result. An indeterminate test result must be documented as indeterminate and not result in repeat testing by the panel physician, chest X-ray, or B2 classification. However, for applicants with an indeterminate test result, a repeat IGRA after arrival in the U.S. is recommended for their health, but not required. In this segment, we will focus on our final learning objective, turnaround times. These guidelines ensure that results are obtained in a timely manner, allowing for prompt diagnosis and appropriate intervention. IGRA results should be available within 72 hours of sample collection. In summary, you should now be familiar with the following interferon gamma release assay, IGRA, testing guidelines. 1. Testing age requirements for those requiring IGRA testing. 2. Approved IGRA tests that can be used. 3. Important steps after blood collection. 4. Reacting to an indeterminate result. 5. Turnaround times. For more information, visit www.cdc.gov/immigrant-refugee health.